You're stuck in traffic, you're bored to death, you're trying to make it yourself comfortable while you're driving, and this is what you do. Putting your arm by the window. Why is that bad? And what to do next? This is Dr. Shakib from Irvine Spinal Wellness Center, your Irvine Chiropractic Clinic. Stay tuned. All right, so you're driving, you're stuck in traffic, stop and go, you're trying to make yourself nice and comfortable, and what ends up happening is you either lean towards the armrest, or you put your arm up by the window. Neither one of these are okay. You already know that. But why is it important for you to not blow it off and just think, I'm more comfortable? What you want to do is not to lean to one side versus the other. And a lot of times that becomes you. In other words, you don't even need to lean this way because you're in a stop and go traffic, but you do it anyway. Or you're driving with one arm while this other arm is sitting by the window. Well, that actually creates a lot of tension in your neck and upper trap area here, which you overutilize while you're sitting behind the desk. So don't give more load to a muscle that's already given you all it could give and more. So that is not a good idea. Make sure you're holding on to the steering wheel, not at the 3 and 9, not at 2 and 10, but more like at 4 and 8. Relax with your shoulders, with your upper trap, the top of your torso, down with your elbows by you, not squeezed by you, but comfortably by you with a little bit of a wiggle room. What you want to do when you're stuck in traffic, I really like these lumbar supports that you can get from Amazon. They're about $10. They're mesh, there is no cushion to it, but it has a nice curvature. You can slide it up and down your seat as you're driving and stuck in traffic or long distance trips. So you want to, even though it's called a lumbar support, it's not a pillow once again. You can move that up in the more of a thoracic area, move it down, just move it around as much as you can or as often as possible. The other thing you want to make sure you do is you scoot yourself in to centralize your tush on the seat. A lot of times, I've noticed this quite a bit when I evaluate my patients' driving habits. I notice that they don't really go in to sit in the center part of their seat. They're kind of tilted without even realizing. Over time, that causes a lot of issues. And finally, make sure your seat's closer to the steering wheel. Many times, especially for women driving bigger cars, our thighs are not long enough, typically, many times, depending on the car, to really reach the pedals. So what you do is you almost distract or traction out your knee joint, which causes a lot of knee issues. So move your seat closer to the gas and brake so you're not really, in a subtle way, struggling to use those. And that's about it. It's amazing how little things add up, and it's amazing how easy it is to give the body what it needs to give us what we want it to do. If you have any questions, make sure you put the questions down below after you watch this video, or shoot us an email, or contact us on one of the methods of contact that I'll put in the description box. Make sure you subscribe and share this video with your loved ones. Thanks for watching.